Hello, I'm Shamala. I'm pursuing my degree in psychology in OUM. So today I will be presenting qualities of an effective counselor and ethical communication for the subject called Introduction to Counseling. Today's presentation outcomes will be the core qualities of an effective counselor, the 4 stages of therapeutic listening, and how ethical communication strengthens the counseling relationship. First of all, I would like to start off with a quote. Counseling is a discussion between a trained counselor and an individual who experiences confusion and needs help. So this brings me to the therapeutic alliance. So the importance of therapeutic alliance is to build a relationship in the first place, and this is the crucial stage of a counseling session. So some empirical evidence demonstrates that a therapeutic relationship accounts for approximately 30% of the outcome variance in psychotherapy, and making it one of the most powerful predictors of treatment success. The core quality number 1 is empathy. What is empathy? Sensing the client's private world as if it were your own world. This is defined by Rogers, 1957. And Rogers apparently is a proponent of a person-centered therapy, which empathy construct is embedded in the person-centered therapy. So it's different from sympathy. Why? Because sympathy is you feel for people. Empathy is you feel with the people. So empathy is active listening plus reflective emotional content. That is empathy. And why is it important? The importance of empathy is to reduce the client's isolation, loneliness, and to validate the emotional experience and to build trust between the counselor and the client. Number 2, unconditional positive regard. What is UPR? UPR, according to Rogers, total acceptance of the client as a worthy human being. So I have also taken from the OEM notes, a counselor must trust every human being created by God. And this is the most useful principle and valuable and uniqueness of a human being. And no conditions must be attached to the acceptance of a human being. Whether the human being is bad or good or whatever, do not judge. Separate the person from the behavior. Core quality number 3, congruence or genuineness. So what is congruence? A counselor's internal experience must match with the external expression. No hiding behind the facade, the professional counselor facade and so on. And the counselor must be authentic and transparent with the client. And why is this important? It models the authenticity for the client. It reduces the perceived threat. Sometimes clients may feel threatening because you're a professional and so on. And it facilitates corrective relational experience as well. So now we can compare between the 3 core qualities. For example, empathy, as I said before, understanding the inner world of the client. I feel what you feel. That is an example of empathy. UPR, accepting the person as a whole. So maybe you are acceptable as you are, and congruence is authenticity and transparency. You can trust that I am real, so that kind of 3 qualities will encourage the clients to reveal their issues. As the counselors, we need to have therapeutic listening. So therapeutic listening has 4 stages. Stage 1 is sensing. But what is therapeutic listening? Listening is an active form of behavior in which individuals attempt to maximize the attention to, not only maximize, but also comprehend of what is being communicated. Yeah, so the father of listening, Walvin, has defined this definition. And also, immediately after 10 minutes presentation, most people recall only half of what was said. After 48 hours, this drops to roughly around 25%. That was an empirical study conducted by Stromer and in 1986. So human minds, basically we can process around 500 words per minute, and people speak at 1 to 5 to 150 words per minute. So this gap creates the opportunity of distraction. Why we need to improve and how we need to improve. So look at the person directly and read the body language and the tone of the speech, and also focus attention deliberately on the client. Stage 2 of therapeutic listening is understanding. So the definition is to process and interpret the messages. Instead of thinking of what to say next, programming in the mind what to say next, and and so on. Concentrate on what is being said now. That's why mindfulness is important. Try to understand from the speaker's standpoint. This is empathy. And understanding precedes the intervention. Do not try to fix what you have not yet fully grasped from the client. Stage 3 of therapeutic listening is evaluating. Is appraising and analyzing the message. So the process is simple. Sort and classify what you are hearing, and also analyze the implications, the application, benefit, and the damages that it might cause. So this is caution given by all the father of counselors. Do not judge until the comprehension is totally completed. Stage 4 of therapeutic listening is responding. So acting on the message based on understanding. So the type of responses are three: positive, neutral, and negative. So positive is supporting, affirming. For example, it took courage for you to come here today. This is a strong decision that you have made. Negative responses are: you say that you want to pass your exams, but you haven't opened your textbooks in 2 weeks. Help me to understand that gap. Neutral is reflective and clarifying. For example, so what I hear you saying is that you feel anxious every time the lecturer calls on you. Is that right? Yeah. So ethical requirement is you have to respond proportionately and respectfully, and the voice must be mellowed, and always maintain client dignity. Don't put the client down. Let's move on to the third learning outcome: how ethical communication strengthens counseling relationship. So this is from the BACP framework. There are 6 principles. Confidentiality. The application is maintain privacy and disclose only when consented upon. So when can confidentiality be breached? Clients are at immediate serious risk for harm to self or others. So required by law, maybe terrorism or child protection and so on. Client gives voluntary consent, only then disclose at the minimum necessary information to the minimum necessary people. So that contains confidentiality. Transparency, be clear about the services and limits and the qualifications of it, and do not harm, and also avoid any physical, psychological, and emotional harm to the client. And best interest is act to promote clients' well-being and support clients' rights and their own decisions, and collaboration work in partnership with possible parties. A little bit on practical tips for ethical communication. Before the session, establish clear informed consent about confidentiality limits and so on, and create a private and distraction-free environment in the setting. During the session, use active listening, like what I have said just now, eye contact, nodding, reflection, and so on. Avoid interrupting, allow silence. Silence is golden, right? So allow silence. Use open-ended questions. For example, can you tell me more about what that anxiety feels like in your body? And after the session, document all the decisions and rationale, and seek supervision if you are unclear to some other parties, some other professional parties. As a conclusion, we know now there are three core qualities: empathy, UPR, and congruence. These are essential for therapeutic change in a client. Number two is we have learned about 4 stages of listening: sensing, understanding, evaluating, and responding. So the most important part is listening and sensing. Sensing using your ears, and then understanding. The ethical communication, there are 6 ethical principles by this framework. Confidentiality is the rule. Breach must be very carefully made. If you're not sure, you consult some superior, some people with experience. If any ethical dilemma is happening, and always collaborate with the client first. The code for all these messages is: techniques alone do not guarantee well-being. You can have many techniques, but it is alone do not guarantee well-being of the client. The quality of the therapeutic relationship with the client will help a lot. This is what will heal the client. These are my references, and thank you very much for listening.